Many new moms do not realize that preparing their breast and their nipples before breastfeeding makes breastfeeding much more easier and very comfortable when their baby arrives. Hey, pretty lovers, welcome back to another video. Today, I'll be talking about a very important topic for every expectant mother out there: how to care for your breast and your nipple before the D-Day. That is, before giving birth. Now, let's dive right into the video. In case you're seeing my face for the first time, my name is Priscilla, a registered and licensed health practitioner and a mom of three. All I do in this channel is to share educative and informative content just like this one. So you sit back while I take you on this ride. I'm happy to be your captain. Let's dive right into it. Many new moms do not realize that preparing their breast and their nipples before breastfeeding makes breastfeeding much more easier and very comfortable when their baby arrives. Now, in this video, I'm going to walk you through simple, safe, and effective ways you can care for your breast and your nipple before that bonding experience with your bundle of joy. Now, why is breast and nipple care very important? During pregnancy, your body goes through a lot of amazing changes, all right, including your breast. Your breast grows in size, the nipple darkens, all right, and the milk glands begin to get prepared for the baby that is coming. Now, proper care of the breast and the nipple, makes your breast very healthy and clean, all right? It prevents soreness and cracked nipples, okay? Now, it also prepares the nipple for your baby to latch on when your baby arrives, okay? It also encourages good milk production. This preparation not only makes breastfeeding easier, but it builds your confidence as a mom. Now, how do you care for the breast? Keep them clean and healthy by, washing with warm water. Nothing harsh, no hard soap this time, okay? Of course, you know that when you are pregnant, even if prior to your pregnancy you are using anything harsh, any soap that is harsh, as soon as you get pregnant, please forget about that harsh products, okay? Use something very mild because your body at this point is very sensitive, okay? So any harsh thing you use at that period of pregnancy can affect your nipple, okay, can affect your skin as well. And that is not what you want because your skin is very sensitive now. All right. So just bathe with your normal, very normal warm water and very mild soap. Wash that area very well. Then by the time you are done, you dry it with a very clean towel. Okay. Damp the nipple with a very clean towel. Then you wear supportive bra. Okay. Most women think that nursing bra should always only be used when you give birth, but that is not true. Okay, you can wear nursing bra even before you give birth. Okay, because the way that bra is formulated, you formulate in such a way that it gives you maximum comfort. Okay, so because the breast is now big, it has increased, it has grown in size, so you need to always wear something very comfortable. Okay, not something with any form of iron or anything metal that will make you uncomfortable. No. So okay, so because you don't want to have a sagging breast after birth, always try to wear that supportive bra, okay, because of the weight of that breast so that it can always be firm. Then you massage gently, okay, massage in a circular motion, gently, not hard. Okay, what this does is to improve the flow of blood, okay, the flow of blood circulation, then to also prepare the milk ducts, all right. Start preparing them for your baby's arrival. Then observe for any changes, all right. Very, very observant, because at this point, like I said, you are your body is very, very sensitive. So watch out for any changes, okay, like redness of the breast, like hardness, anything that you feel is not normal. Okay, instead of talking to your mother-in-law or your auntie in the village or your neighbor, please tell it to your doctor. That is why you attend antenatal classes, so that you can share your concern and get professional advice on the right thing to do. Now, how do you care for your nipple before childbirth? You always keep your nipple clean and dry. Just like I mentioned when I was talking about the care of the breast. The way you care for the breast is a bit different, slightly different from the way you care for your nipple. Okay? Now, for the care of the nipple, after taking your bath, always try to dry up, use a clean towel and make sure the nipple is dried. It's not moist. Okay? Then, if you must lubricate, use natural lubricants. Don't use anything that is harsh. Use very natural lubricants. We recommend olive oil. Okay? It's very okay, or pure coconut oil, just to you know, lubricate that breast, to avoid that nipple, to avoid soreness or crackness. Okay, anything harsh will interfere with the natural lubricant on that nipple and you can start having soreness of the nipple, and that is not what you want. Now, you should expose your breast sometimes, okay? It is okay to expose your breast while sleeping at night. Expose the nipple for air. Let it ventilate, let it breathe. Okay, allow the breast to breathe at night while you have packaged during the day, with your nursing bra, just to make sure you don't have a sagging bee after childbirth. When you are sleeping, allow that place to breathe. Okay, let it breathe. It's very, very important. Then if you observe that you have inverted nipple is when your nipple is not prominent, it's not protruding, but it's inside. You're going to have problem when you give birth. We've seen mothers who give birth and they are not able to breastfeed. Not because they are not lactating. Of course, the breast is engorged, it's full, but they could not pass that milk to the baby. Why? Because there is nothing for that baby to latch on. That shows that there was no proper care of the nipple before breastfeeding. If your nipple is inverted, try to bring it out with your hand, okay? Keep working on it, and make sure it is out before the before your due date, so that you don't give birth and you're not able to breastfeed your baby. You go through pain. Now, you should understand that during the last month of pregnancy, your body begins to produce colostrum. Colostrum is that yellowish milk that comes out first when you initiate breastfeeding. All right. Now, it is very okay for part of those milk to begin to leak. Okay. So if you notice that what you are wearing is soaked, milk is beginning to escape at your last months of pregnancy, it is perfectly okay. So it is nothing to worry about. There are some signs you should look at for in your breast that will prompt you to seek medical attention. Okay. So if you begin to notice persistent pain in your breast, we know that during pregnancy, the breast is tender and is a bit painful. But if you discover that that pain is something that you can't bear, it's getting out of normal, you should speak to your doctor. Okay. If you also observe that your breast is reddish, okay, it's reddish. You can't explain it. It's just red and inflamed. Please also speak to your doctor. Now, should you also notice any discharge, abnormal discharge that is not breast milk, it's very important you speak to your doctor as well. If you also notice any lump on your breast, it calls for attention. Please see your doctor and speak with your doctor. Share all your experiences. Do not keep anyone. That is the reason why you have a healthcare provider. That's the reason why you attend antenatal classes. So when you notice any of these symptoms or signs, instead of speaking to your friend, to somebody who you think has given birth before, because one person's experience cannot be another person's experience. We all differ, our bodies differs. So the best person to speak to, should you have any concern during your pregnancy, is not your friend who you feel she just gave birth. No, she has the experience, she can talk to me. Please talk to your healthcare provider. You need professional advice. Now, don't forget that caring for your breast and your nipples before breastfeeding helps you start breastfeeding with confidence, with comfort, and with joy, okay, as a new mom. All right. Don't forget that that breast is about to nurture a life or lives. So you should treat that breast with all care and gentleness. If you found this video helpful, do not scroll past. Drop me a comment, okay? If you haven't subscribed, please subscribe. And most importantly, share this video to every woman in your contact. I'll see you in my next one.